having a pregnancy after loss can mean very different things to everybody. There's no one size fits all with how a person will react to that pregnancy. Some people are hyper attached to that baby, and some people are super detached from that baby. Once again, there's no right or wrong, it just is. Pregnancy after loss can feel really terrifying. And so it's really important, especially as you near delivery, that you have your birth plan, like your actual birth plan as you would with any other pregnancy, but really a specialized birth plan that you've discussed with your care provider so that you know exactly what you're walking into. Some things to include on that are you going to participate in a birth class? Will it be a traditional birth class with other families? Do you need more individualized care? Previewing the hospital, discussing, do you want a different room than what you had before? But some families want the same room to create a more positive memory or to have, some attachment to their baby that has passed away. Pain management, every pregnancy and every delivery is different, but it's important to revisit that choice every time. Walking into a hospital when you're in labor can feel very terrifying. You're reliving an experience you already had, most likely, and you need to decide what kind of physical pain are you capable of holding, along with the emotional experience that you will be having. Visitors is also really important. So the support that you have while you're in labor, who do you want in the hospital room with you? Will you have family? Will you have a mother or mother-in-law, a trusted, doula or midwife? Or do you want it very private, just you and your partner or you and a birth coach? Also, visitors after the baby is born. When you lose a baby, your whole community really does grieve with you. They mourn that loss for you. If they could, they would take that pain away. And so when the birth of another baby comes, without understanding, many times they think you're going to be okay now. They don't realize all of the extra emotions that go with that. And so knowing if you're ready to have visitors to meet that baby is something that needs to be considered. And it's important to discuss all those things with your OB. It's important to discuss those things with the nurses on duty so that they can act as kind of, the middle person between a person coming up to check in to postpartum to visit with you, and they can, either prep that person for what to expect or say, I'm really sorry they're not accepting visitors at this time, and allow them to carry that so that you don't have to. Your job when you have a baby is to bond with your baby and to be present in that moment. You don't have to worry about what the other people, are wanting to have happen. So it's really important to have these discussions. It's important to think about them before you're in the moment. It's also okay that when you have a birth plan, my OB called it a birth wish. We want things to go a certain way, but we have to be flexible to know that, number one, we can't control everything, but number two, sometimes our decisions change when we're in the moment. What you think you might want might be different when it comes down to it. So it's important just to start thinking about those things and having that conversation so that you at least have a framework for what to expect.